Join Health Click on an evidence-based educational journey into balance and falls in the elderly population. This course is an essential resource for clinicians who are working with the older population to gain a greater understanding of the many factors that can lead to dysfunctional movement and increased fall risk.
And when we talk about balance, unfortunately, there's not one test that we can use that's going to adequately evaluate all the different portions of balance that we need to look at. And so we're going to be looking at how can we look at all the different portions of balance, but not have to do tons and tons of testing because we don't have time to do that in the clinic. If we look at the motor components of balance, we have reflexes, we have automatic postural reactions, anticipatory, and voluntary. So it's kind of a continuum. When we look at the reflex side, we have primarily the vestibular spinal reflex and the vestibular ocular reflex. And we're not going to be really focusing on the vestibular ocular reflex today, but the vestibular spinal reflex really are those postural reactions that we have that align the head and the trunk and the body. Automatic postural reactions are those that occur from an external perturbation. So if you're walking and somebody bumps into you, or you're walking and something slips underneath of you. Anticipatory postural control is an internal perturbation, so that when you go to lift your arm up, maybe to reach for something, then you have to have anticipatory postural reactions. With that, when you go to lift your arm up, that's where most of the studies have been done. If somebody raises their arm up, the prime mover that turns on first is not the deltoid, the anterior deltoid, but actually it's either the paraspinals and or the hamstring muscles, so that it basically sets the body so you don't fall over when you lift your arm up. On the other end of the spectrum, we have the voluntary types of movements, and that's a whole continuum of movements that we can have that are voluntary. They generally are not dependent on a stimulus, and they can be slow or fast.
Learn critical information, utilize specific assessment tools, and interpret the results to develop individualized programs to improve mobility and decrease falls. Discover evidence-based research and clinically proven techniques to maximize safe, functional movement with the aging population and enhance the clinician's ability to perform comprehensive examinations for older adults with an orthopedic, neurological, and cardiopulmonary diagnosis. Explore in-depth information provided about the aging population to include age-related physiological changes, comorbidities, and pharmaceutical side effects. Learn the different vestibular, visual, musculoskeletal, neurological, and pharmacological reasons for fall risk and decreased functional mobility. Develop a comprehensive approach incorporating appropriate tests in order to perform a thorough examination for fall prevention. Specific treatments are explained and demonstrated with a focus on the use of each treatment in a targeted treatment approach.